A couple things I wanted to say before I got started. This is Milo, my therapy dog. When I had my solo practice out of my house, he was a certified therapy dog, so he's kind of retired now. But he is still kind of a guru, as people that meet him say. He's one of those animals that has that really high emotional intelligence. So he's really fun to be around. So what I wanted to start with is a quote from Richard Bowles, who was the person who wrote What Color is Your Parachute, like back in the 80s. And he said something like, when a client comes to you, or in our case a patient comes to you, there are two wounded people in the room, but we silently agree that we're only going to deal with the patient's pain and not ours. And what these are just, okay. So what we're going to do today is deal not necessarily with our pain, but with some of our feelings. But first, to get our CME credit, we have to do a little bit of talk about the research and data. So first, there's a couple studies using expressive writing in patients. And there was a good study that just did 20 minutes of writing in 3 consecutive days for rheumatoid arthritis patients and asthma patients. And these exercises are not, we're not going to write about the most stressful event in our lives today, but that's what they had these patients do. And the subject patients, and the controls wrote about a neutral subject like their daily plans or something like that. So 70 of the patients in the stressful group and the subject group showed improvement on objective clinical findings compared with only 37 with the control group. So they improved and they also didn't deteriorate in their findings of health. And some of the findings were fewer visits to the physician, improved immune system functioning on blood tests, reduced blood pressure, improved lung function, and improved liver function tests. Longer-term effects showed fewer days in the hospital, improved mood and affect, feelings of greater psychological well-being, reduced depression symptoms, and fewer post-traumatic intrusion and avoidance symptoms. So I sort of separated out the social and behavioral benefits, and they included reduced absenteeism, quicker reemployment after job loss, improved working memory, improved sporting performance, and higher grade point out for the students. So if we move on to gratitude, instead of writing about stress, we're writing about gratitude. There are also findings that showed that this improved not only people's well-being and subjective feelings, but also their objective feelings in better sleep, fewer symptoms, more happiness among adults and kids. So moving from patients to us, the physicians who see themselves as a healer can sometimes feel lost in all this EMR stuff that Angela talked about, all the check boxes, all the inbox messaging, all these things. It's like, wait, what happened? What am I doing? This is a hummingbird. It was on one of my salvia plants this week. And it reminded me of being in the EHR and kind of running from one thing to another, and somebody coming in the room and giving you a message with somebody on the phone that needs to talk to you, and the next patient's ready, and they're kind of flitting around from one thing to another. So if we look at what we talked a little bit about this morning, that depending on what study you look at, somewhere between 40 and 60 or even more % of physicians are burnt out, and even more showing at least one symptom. So the 3 kind of classic things that we use to look at burnout in physicians are emotional exhaustion, depersonalization, and low personal accomplishment. We as wounded healers need time to slow down from our hectic pace of our lives and just sit or walk and just be. And journaling is a way to do that. And so we're going to, everyone find their journal. first one that we're going to do is I kind of took those 3 signs of burnout, and we're going to do an exercise for each of them. The first one is the emotional exhaustion. So this would be thinking of a time when you just felt kind of overwhelmed and everything was, you weren't finding joy in anything, you weren't enjoying things. One example from my life was something, I have a love-hate relationship with Facebook, like I'm sure a lot of you do if you're on Facebook. But one of the things that is interesting is the memories that pop up sometimes. And this week, the memory of 6 years ago popped up, 6 years ago yesterday actually, and it was the day my father died. And I grew up in Missouri, he was a barber, so he knew everyone in the community. And I was living in Southern California at the time, and during the last 2 years of his life, I spent a lot of time flying back and forth when he was in the hospital, or taking him to appointments, trying to figure out what was going on with him. He was in his late 80s. And got to see some of the not so good sides of our profession, and how sometimes patients aren't listened to, and it's hard even as a physician to sometimes navigate the system. And so I often wonder what happens to families that don't have a physician. But anyway, I did get to spend the last 10 days of his life caring for him in our home that I grew up in. And then I had to leave because my daughter was starting college, and so I decided to leave and help her move into her dorm. And while we were at breakfast that morning, I get the call that my dad had passed away. And my daughter was just kind of devastated. She's like, "This is supposed to be my day." And I was just kind of like, "Wow, what am I supposed to do with all this?" And we were in, if anybody's from Chicago, we were in Walker Brothers Pancake House, which my dad loved. I went to college at Northwestern too, which is where my daughter went. And he loved going there when he'd come to visit, and when we would go there, he would talk to the chefs. He would talk to the line cooks. And so I'm sitting there, went out in the lobby because I was just kind of overwhelmed with emotion, and a woman came out and talked to me and said, "What's going on? Are you okay?" And I said, "Oh, my father passed away, but I can't think about that right now because I need to help, go shopping with my daughter to find things for her dorm room." And she just said, "Tell me about your dad." And I just told her, how much he loved that restaurant, and just talked to him about a few things, and just realized all of the valuable things and things that I appreciated about my dad. And then the rest of the day was able to do what he did for me when I went to college, which is, put things up on the wall and, find a carpet for the floor and things like that. So what we're going to do is we're going to take 3 minutes and just write down a few things that you're grateful for. If I can find it. Here's some tips. So you can write down your health, you can write down your kids, your spouse, your dog. But I think of those as kind of normal things. So try to think of something maybe that you don't always think of when you're looking at gratitude. Going for depth over breadth is to look at not necessarily the number of things you write down, but maybe one that's a little bit maybe hard to see the gratitude in, but when you do, it's really deep, like being able to be with somebody when they die. Often people rather than things is good. So maybe your new car, but maybe your the woman that came and talked to me at breakfast that morning. If you're having trouble, and some days you will, and try to imagine life without certain things. So, how many of you have read the book, I can't think what it's called, Breath Without Air?
Rest becomes air. Rest becomes air.
Right. So, just the air we breathe, you can imagine. If you find something that's surprising that you write down, kind of savor it and say, "Wow, that's interesting. I never thought I would be thankful for that." The adaptation, this is an interesting one. There's some people that write about gratitude and teach about it and say you shouldn't do it every day because you become habituated to it and you don't notice things as much. Personally, in my patients, I find the opposite. When I do it then I begin to notice more things. And if I say, oh, I'm going to do it once a week or twice a week, then I tend to forget even on, if you're going to do it on Sunday, I tend to forget on Sunday. But see what works for you. So the second one is the depersonalization. This one is, so each of us experiences these symptoms of burnout or these signs of burnout in different ways. I teach in our family medicine residency, and when I did a workshop and did some of these exercises with some of the family medicine residents, one of the residents said he'd been on a really busy ward service and had like 3 or 4 patients die and really didn't have any time to talk to anybody about it or think about what happened. And he said he was really got in the mode and being on this ward service of thinking of, the congestive heart failure in that room and the patient pancreatic cancer in the other room, and didn't really think of them as people. And it was interesting, after he did this exercise, he told me the next day that he hadn't slept through the night in like 3 or 4 months, and he slept through the night that night. And so I think it just sort of speaks to the value of having time taking a little bit of time, it doesn't even have to be that long, to write. And I think writing with a pen and paper as opposed to on the computer works better. There's something very real about the connection. It gets our real person onto the paper. Sometimes how you write, if you write very small or very large compared to how you normally write, it may give you some ideas about what's happening inside of you. So for this one, and this is kind of just a taste so that you can do more of this later because we don't have a lot of time today, but just choose a patient who is a challenge. When you see them on your schedule, you think, like, I hope they don't show. Or, gosh, we never have enough time. We do ballot. How many people have been in a ballot group? I think it's a family, is it only a family medicine thing? I'm not sure, but it was started in the 1920s and written by a psychiatrist and a general practitioner, and basically you take a case that is bugging you for some reason, and then you present it, and then after the person presents it, really briefly, we put them in a bubble, and they just observe them. They're there, but and then the other people, the other physicians in the room say, well, if I as a physician taking care of this person, this is what I feel. And then you move into, as the patient, this is what I feel. And so and it's an incredibly healing process for that physician who's having trouble to see how other people would react to the same situation. Sometimes get a little different perspective on it. So that's one way to think of this exercise. Another is to think of that person and think, how hard would it be to be them? If you're a grouch and you're the person that nobody in the doctor's office wants to see coming, like, think of how hard that must be for them. Another is to imagine them on their deathbed, because it's all, we're all going to die, right? As we were reminded this morning. I pulled out my app and showed Roshi during the talk on happiness this morning. I have this app called We Croak. And how many people have that? Does any of us have that? So it's like a couple bucks. It's the people in Bhutan, which have gotten noted as being the happiest country on earth, say that if you meditate on death 5 times a day, you're happier. And so it just pops up on your screen, and it just says you are going to die. And then if you click on it, it gives you a quote. And so someone told me about this like a year or 2 ago, and I thought, well, that's really nice. And I didn't get the app or anything at that point. And then I saw her this summer, and she said the same thing to me, and I thought, I really like her, she's really into this, I'm going to try it. And it really is incredible how big things things become tiny when you realize, like, you know, it doesn't really matter. Yeah. Oh, it's called we croak. So like a frog, croaking, C-R-O-A-K. Sorry, I didn't put it up there. It has a little frog. So anyway, well, so I mean, it is interesting to think about how small things become. And yeah, you know, honestly, my mom died last summer, and I have never felt closer to her than I have this past year. She's always present. She's always reminding me of things. She's always, you know, always there. Much more so than when she was alive, actually. The sort of I can't think of the word, but the sort of annoying parts of people's personalities go away, and the good parts stay. So another way, back to the exercise, another way to think of it is thinking of them as a baby. I love babies, probably most of you do, I hope. But babies are so innocent and cute and fun, and it's fun to play with their feet, and so that's another way to think of somebody who's plugging in. Or as somebody who does something good for someone you care about. So this is maybe for family members, like your father-in-law or mother-in-law or somebody. If they bug you, you can think of good things they did for somebody else in your life. The third one is low personal accomplishment. And this is, studies show that this is a lot more common in female physicians than in male physicians, but probably everyone experiences it at some time. When I was trying to think of an example for this one, there were a lot come to mind. This is an easy one for me, but one that kind of made me laugh was we bought these 5 acres in Napa to do retreats, right? And I was walking. We had some trails put in. And I was walking on these trails the other day and got to this huge. I didn't put pictures of it because they turned out kind of blurry, but this huge tree had fallen onto the trail. And it turned out it was a branch from these giant California oaks, right? And I texted my husband and said, "There's a branch on our trail," and he's like, "Well, move it." And I was like, he had no idea. So I thought, you know, I don't know who to call to move the tree. And it turned out those Orchard hardware stores, which I love, those Orchard hardware stores, they're going out of business. So I had seen this sign that they were going out of business, and I went there looking for something else, and they had all these chainsaws. I said, "Well, I've never had a chainsaw." I went home, and then I thought, I'm going to go back and get a chainsaw. And we had a friend visiting from college who is a Jesuit priest now, who's like probably weighs like 110 pounds. I mean, he's this tiny guy. He's in his 60s. My husband's an engineering professor, and me. And we cut up this giant tree. And we had so much fun. Because we were kind of like, what are we going to do? My friend was with us. He was training for the Camino. He left yesterday to go walk the Camino in Spain. And so he really needed to get his 5 miles of walking in every day. And so he was really disappointed when the trail was blocked. And I'm like, we can't wait for somebody else to come. We've got to get this trail cleared. So in our physician work, it's remembering a patient that you helped instead of remembering patients that that got frustrated and left. Noticing something that wouldn't have happened without you. This is what I do for the residents, is try to remember something, try to notice something that happened. If you hadn't been there, that patient wouldn't have gotten what they needed. One of our interns had family members weren't going to be able to be at the bedside of this patient that was dying because of the rules of the ICU and stuff, and he said, this isn't right, and was able to make that happen for that family. Have you guys all seen It's a Wonderful Life?
Yes.
I made my kids watch it every year at the holidays. Somehow I can't find it anymore. I think they've stolen my DVD. It is a little long, but it's a great, movie of how, if he hadn't been in there, it goes back through what would have happened to this little town if he hadn't been born. And if you can't think of anything, then think of something that your children, a student, a patient accomplished, like a patient that stopped smoking, or a patient that was able to get better and take care of their family. Can you promise me that in the next 24 hours, you'll tell somebody one of those 3 stories? And if you don't have anybody else to tell, or you want to tell me, shoot me an email and we'll talk. Because it is important to share these stories with each other. So this is just I wanted you to just take a minute or 10 seconds and look around the room. It's amazing to me. I've been amazed all morning at the power of healing that's in this room. Such kind, loving people that work so hard for their patients. It's really pretty incredible, and I love being with you guys. So I'm just going to end. These are just the references and stuff if anybody wants those. With one quote from Howard Thurman, I've become a huge fan of Howard Thurman. There's something in you that waits and listens for the sounds of the genuine in yourself. That is the only true guide you will ever have or ever need. So take your journals home and keep writing in them. Thank you.